Hey, this is Dr. Steve, your mayor. I'm going to bring you a COVID-19 update for this week. We're still seeing numbers that are much higher than what we've seen in the past, and so there's still a lot of COVID activity out there. We're not as bad as some areas of the state, like for example in Jackson, they're out of all ICU beds. And so they don't have any ventilator capacity. What that means, if you're really sick, you don't have any resources to take care of you. And we don't want it to get that way here. I want to talk about some facts and some fallacies because it's important to me that I sort through the literature and kind of present you with my best understanding of what really works and what doesn't work in controlling the virus. Here's what the latest information talks about how the virus is transferred. It's by close contact and it's person to person. Well, okay, we kind of knew that, right? But here's how they define it. The health department will define it if they say, should I get tested because I've been exposed to a positive person in my workplace? If you've had greater than 15 minutes of contact and less than 6 feet apart, is when they say you need to be tested. So what we're seeing is that it's more of the close contact and less of the surface contact that we have to worry about. So it's still important to wash our hands and not touch our face. But when you think about what they're worried about, it's that close contact. So the social distancing is still a very important tool that we can use. And then the mask. You know, I don't understand the controversy on the mask. If it's something that doesn't hurt us, and we know that it protects the other people, if you're coughing, sneezing, or even talking loudly and the virus is transmitted in your mucus or saliva, and it acts as a barrier to protect other people from getting it. And then for the person that's wearing it, if you're in close contact and the virus is transferred by mucous membrane, so it lands on your arms or it lands on your hands, that doesn't matter. It has to get in your mucous membranes. That's your nose, your mouth, or your eyes. And if you have that covered, that's going to give you some level of protection as well. So that's why masks are important. That's why we want masks to be worn in every public place. That's why if you can't social distance very well, which you should be doing, a mask will give you a little bit extra protection. So look, this is very important. Wear your mask. We don't want to spread it. Look, most young people will have good outcomes, although there are a few tragic deaths that occur with this. But it's the older people and the people that have additional medical problems that are really having the problem. And what's happening, here's what I see in my clinic. We're seeing people that are being tested for COVID and they're supposed to be quarantined, but they're going to visit grandma, friends are coming in to visit them, and they're infecting other people. So if you get tested, you need to quarantine yourself or anybody else. You don't go out, you don't have people coming in. And if you have these symptoms, these are the ones that we're seeing now: sore throat, flu-like symptoms, that means muscle aches, chills, and fever, and diarrhea, then you need to get tested. And when you are tested, make sure you quarantine. Look, we can get through this together, but it's going to take all of us working together. The use of masks, staying 6 feet apart, and not having large gatherings, those are the tools that we need to do to keep us safe.